metabolic disorders in general are growing so much, and in the next 5 years, that's going to be the biggest pandemic we're going to have.
Now patient comes with the already search in ChatGPT.
Hi guys. So today we are going to talk about a organ that a lot of people are not talking about, something that is going to give us a 360-degree view of a disease that, if we talk daily, it takes about 3000 plus lives in the world. So let's go to the specialist in this and see what he has to say about all of this. So Dr. Hardik, can you please give us a bit of background about yourself so that the viewers know what you do and how it goes?
So myself is Dr. Hardik Parikh, and I am a medical gastroenterologist and hepatologist, and I am working in Ahmedabad for last 10 years.
Okay.
So more or less, gastroenterologist and hepatologist. So they practice in both for liver and GI.
Hmm.
And if I see, uh, my practice is private clinic like.
Okay.
So day in and out we see patients of liver disease and gut. So that is cornerstone of my practice right now.
So I wanted to start with liver, but because you said gastro and hepatologist, something which I personally have observed is a lot of doctors mix gastrologist and hepatologist for their specialties. And I want to know, how are these organs actually connected? Why do doctors prefer to have, for example, specialized in liver if they are already in gut?
So there is a specialty branch now. It is only hepatologist.
Okay.
So only hepatology practice in India started in last 2, 3, or 5 years down the
Okay.
line. DM in
Okay.
hepatology, per liver or gut. So this is I'm going to go basic that
Yeah, yeah.
everyone can hear and understand.
Sure.
So गट जो 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 भी हम
Hmm.
खाना खाते हैं वो डाइजेस्टिव सिस्टम डाइजेस्ट करता है.
Yeah.
उसके बाद उसको मेटाबोलाइज करने के लिए, व्हाट इज मेटाबॉलिज्म? मेटाबॉलिज्म मीन्स जो भी खाना अपना प्रोसेस होता है बॉडी में,
Yeah.
सो वो मेटाबॉलिक ऑर्गन एक लिवर होता है. और
Okay.
वो पूरा मेटाबॉलिज्म जो होता है उसके बाद थोड़ा बहुत एक्सक्रीटरी फंक्शन, जो टॉक्सिन अपने बॉडी में आते हैं उसको भी क्लियर करने का काम लिवर करता है. सो हाउ दिस टू आर कनेक्टेड? इफ आई ईट समथिंग,
Yeah.
it will go from intestine to a portal vein,
Okay.
and from the portal vein all the our food will go to process to the liver. Liver will process all the food,
Yeah.
and from that it can, if that those nutrients are needed, that it sent back to our systems,
Right.
and those who are toxins or bad things, they will get removed through the bile.
So, if I'm not getting it wrong from a viewer's point of view, they're basically so connected that you can't work without each other.
Yes.
So, if the gut needs to be healthy, then so does the liver. It's not like if the liver is not okay, then your metabolism will be fine.
No, because gut metabolism is directly linked to gut flora. Because
Okay.
gut flora, whatever, because half of the digestion, majority of the digestion will take in the gut system. So without one or two, if the cirrhosis will occur, if the gut, there is a problem with the liver,
Yeah.
then there is going to be a patient will have a symptoms of GI, and if there is a problem with GI system, liver will say,
Okay.
oh hi, you have to do something.
That's something I think not a lot of people talk about, that how interconnected liver and gut can be. If your gut is healthy, then usually doctors or in general people focus more on their gut only. They wouldn't see the other organs ke हाँ भाई liver में क्या हो रहा है या what my metabolism is doing. They wouldn't focus too much on that. What do you think would be the reason?
uh, Basically liver is the silent, consider we it as a
Yeah.
silent organ. So if you see, the term silent diseases is applied for blood pressure,
Right.
diabetes,
Right.
liver disease,
Okay.
and kidney disease.
Okay.
बिकॉज लिवर में पेन रिसेप्टर्स नहीं होते हैं. लिवर की जो कैप्सूल होती है उसमें पेन रिसेप्टर होता है. तो वो जो लिवर में इन्फ्लेमेशन होता है
Right.
इनिशियल स्टेज में कभी भी मालूम नहीं पड़ता है. एंड
Okay.
once over a period of time the damage reaches to a certain liver, because नॉर्मल इंडिविजुअल अगर उसका 20 to 30% लिवर भी सफिशिएंट काम कर रहा है तो उसको तब तक मालूम नहीं पड़ेगा कि मेरा लिवर डैमेज चालू है. सो 70-80% ऑफ द लिवर इज
Right.
गेटिंग डैमेज, तब उसको मालूम पड़ेगा। कब मालूम पड़ेगा? पैर में सूजन आएगा, या फिर
Okay.
पेट में पानी भरेगा, या कुछ कुछ ना कुछ सिम्टम्स हो गए, तब उसको मालूम पड़ेगा। तब तक तो 70 और 80% ऑफ लिवर डैमेज तो ऑलरेडी हो चुका होता है। So that is why it is
Right.
called as a
Silent
silent organ.
disease. That was
Like
gonna be
silent
my,
disease, yes, silent
yeah.
disease or silent organ. So that is the main take home. And आपको मैं बोलूँ कि the whole thing why gut and liver is connected.
Hmm.
So अभी की मेरी प्रैक्टिस में हो रहा है कि क्या देखता हूँ मैं कि young person of around 35 to 40 years will come to my OPD.
Yeah.
They will have a problem of acidity, bloating, gas, and constipation,
Hmm.
and they come with ultrasound report of fatty liver.
35.
Yeah, so it is very common, quite common. You find in
Okay.
ultrasound, सर मेरे डॉक्टर को दिखाया था जीपी
Hmm.
को, और उन्होंने बोला फैटी लिवर है, फिर बोला ये तो होता है। सो नहीं, होना नहीं चाहिए।
Hmm.
सो मोस्ट इम्पॉर्टेंट दैट, so why they present with acidity and bloating and constipation and ultrasound report of fatty liver. So I now, even my perspective about fatty liver has changed, and
Okay.
I ask them, focus on your fatty liver. If you correct your fatty liver, your gut symptom will automatically
Okay.
go. I don't ask them to take medicines for acidity. I don't ask them to medicine for bloating. You try to focus as the etiology, because your liver is
Okay.
saying something. There is a fat, so there is inflammation, so something is wrong in the liver. So how,
100%.
this is why I'm want to tell, okay, how does this gut and liver are
Liver work
linked?
together.
We can see daily in OPD practice.
Okay, so basically, liver stays silent, but your gut can give you signs for that.
Yes.
So you should listen when your gut is giving you signs.
Yes, you
Maybe
can
it
take in
can
that
be,
way. You can take in
yeah,
that way.
right?
Your gut is giving first sign
Yeah.
that you are going something wrong in your body.
Hmm.
But if you, at the same time when you do ultrasound, it will show fatty liver. So
Right.
I think very well point.
Okay. So now I want to link this to something a bit personal from my life. So one of my family members has gut issues since about 10 years, like bad gut issues. We went through a lot of doctors, and recently, few months ago, that person was diagnosed with fatty liver grade 3, and a lot of doctors were telling us that this is literally the next stage for cirrhosis. So let's put it this way. Let's first explain people what exactly liver cirrhosis is.
So when you call me up
Yeah.
to do a podcast, I surprised why you are interested for doing podcast.
Yeah.
So I get some reason why you are interested for the podcast.
Yeah.
That is one thing. And see, you told that 10 years you have a GI issue,
Yeah.
and now you are having somebody's telling that you have a grade 3 fatty liver.
Yes.
The diagnostic method,
Hmm.
how we were diagnosing fatty liver,
Hmm.
has now changed.
Okay.
Initially, it was only screening on ultrasound based.
Okay.
So ultrasound means sonography.
Yeah.
So sonography करवाओ, liver में fat आता था। तो तभी, even if you ask me 10 years back, my perception fatty liver है, आप weight loss करो कम हो जाएगा, but I was not going into it.
Hmm.
Okay, not too much of stressing. Now
Hmm.
my consultation has pattern has changed,
Okay.
and I focus more time on concentrating more on fatty liver,
Okay.
so that you can improve. So you told 10 years of the GI issue,
Yes.
and now grade 3 fatty liver. So what
Yes.
happened in last 5-6 years? The fibroscan, which is
Right.
one instrument which is now easily available in country now,
Okay.
because the cost of the instrument is very high, and fibroscan can pick up the liver disease even before
Hmm.
sono can tell you are so 3 to 4 days back, I come to one patient. He was here for my GI symptoms, and I do a
Hmm.
fibroscan. It was showing stiffness of very high. So
Okay.
that means he is already suffering from early cirrhosis. So I picked him up. So I'm happy
Right.
that whatever has happened to your family, we can
You can pick that up early now.
pick that early. And if I advise them aggressive lifestyle modifications,
Hmm.
we can reverse it.
So fibroscan tak to we'll reach when we have an idea what is happening. So reach to that level. Now we talk that liver is a silent organ. It usually doesn't give signs until 70% damaged. Are there any other signs or warnings or something that your body can tell you so that you reach to the level ki we should get a sonography or a fibroscan done or see a doctor?
See, for every person, if we ask to do sonography, it will be difficult.
Yeah.
So I will surely tell that everyone
Hmm.
should undergo at least basic blood checkup.
Hmm.
So basic blood checkup includes liver function test.
Okay.
At least not a liver function test, then SGPT. SGPT, or it is called as a ALT, alanine transaminase.
Yeah.
So if the SGPT is single basic tests, if you do, because blood test in India is easily available, it can
Yeah,
be
very
easily done.
easily.
And this test cost us you around 200 rupees or
Yeah.
not more than that. So that will tell you about the liver health.
Okay.
Okay, because symptoms will occur only when there is some serious problem. So
Exactly.
before that, everyone should be get screen or as a routine blood checkup. My experience, if somebody is coming to my OPD 20 years of age,
Hmm.
and those who are coming 40 years of age, so majority of the problems of fatty liver disease between develops between 20 to 40s. So
Right.
that phase सिम्टम्स तो नहीं आने वाले.
हाँ,
अगर मेरे को
exactly.
दिक्कत होगा तो मैं डॉक्टर के पास जाऊंगा,
Hmm.
डॉक्टर ब्लड इन्वेस्टिगेशन कराएंगे.
हाँ.
पेशेंट को ऐसा लगता है कि ब्लड इन्वेस्टिगेशन करवाते हैं, मैं दवाई लिख के
Right.
दे दो. अच्छा, अभी भी इंडिया में
हाँ.
मेंटालिटी ऐसा है कि जस्ट प्रिस्क्राइबिंग द मेडिसिन, आई विल टेक मेडिसिन, ब्लड इन्वेस्टिगेशन मैं नेक्स्ट टाइम कराऊंगा.
हाँ, बहुत टेस्ट दे दिए डॉक्टर ने, अभी नहीं करवाने, इतने सारे टेस्ट थोड़ी होते
So
हैं.
I insist them,
Yeah.
please, I won't prescribe you any medicine. I will save your money
Right.
at the part of prescribing medicine, but
Hmm.
you do just blood investigation, because blood investigation will tell SGPT. Then if it is right, then we will have so much of information. You
Exactly.
do spend behind ultrasound. So that is my core concept. So you are not going to pick up any silent disease upfront without symptoms.
Of course.
But these things, you do a basic blood workup. And if majority of the times fatty liver कहाँ से पता चलता है, जब पेन होता है तब दो सोनोग्राफी कराने जाते हैं. Nobody will go for doing sonography.
90% of the damage is done by then.
हाँ, बट कोई भी लोग सोनोग्राफी करवाने के लिए सामने से नहीं जाएंगे कि पेट में देख लो.
हाँ.
हाँ, मेरा कट ऑफ ऐसा है कि कोई भी आदमी 40 के आसपास आता है, 40s, at the age of 40, you need mandatory one whole body checkup, including sonography and everything.
Okay.
And I can say you okay, even I was suffering from fatty liver disease.
Oh, really?
Yes. So that is what happened in my life, because this will be easier for the public to understand.
Understand.
Suppose you might have gone for your career. Okay.
Right.
At the what age you gone for your career? Understanding?
So about 18, you
18,
you
19.
start.
So 18, 19, your weight will be around, I'm not asking your weight, but it will
Yeah.
be around, suppose it is a 60 kg of your weight.
Right.
So you are aspiring your career. At that time, you will not much focus on your diet.
Yeah.
Okay. So because we have just entered into a new world, we are
Exactly.
exploring with our friends and families. So we are not much focused on the diet. So 5 kg of weight gain occurs at that during phase.
Just to put a point to that, also coming from the industry, I am a pharmacist too, so I understand your point of view. I feel at that age, when you enter your bachelor years, you're also sitting and studying whole day. It becomes, your activity also becomes very low.
Yes, that is also agree, because
Yeah.
majority of the times in 11th and 12th nowadays it's just 12 hours of the sitting.
Yeah.
So plus खाना बैठे हैं तो भूख लगे,
कोई
खाना.
activity
हाँ,
नहीं
तो
है.
even my kid I can say sitting for a 12 hours and भूख लगेगा, वो खा ले बेटा हो जाएगा. So that type of fatty liver building occurs from that time
Okay.
only. So I can see in 5 kg of weight gain occurs during that time. Once we become married or about to going to engage, and that time, because of new life is engaging, so you get 5 kg of gain during that time.
Okay.
And after that you have a kids at that time.
Yeah.
So not only maternal weight gain, but paternal weight gain
Okay.
also occurs of 5 kg. So my experience, what happened with me,
Yes.
is 15 kg of weight gain was happened when I was
15 kg.
Yes, 15 kg of weight gain was happened from my 20s to 30s.
Okay.
Or 34, 4, 35. And
Yeah.
at that time I was suffering from fatty
Fatty
liver
liver.
disease. And if I ask in my OPD, every patient will note, yes sir, this has happened. Even if you go background yourself,
Right.
if see you in the mirror of old photos and this, it has happened. So
Right.
that 15 kg is what? It is your fat. Is it your muscle? Is it your bone? No,
No, it's fat.
it's only fat.
And also to clarify on this note, because you have had a personal experience, a lot of people, I've seen in my house also, a lot of people think, Arey, you're drinking or you're smoking or you have bad habits or eating habits that are not very good for your body. That's the reason you have it. Is that the only reason, or no activity or anything
I
else
don't
can be?
drink alcohol, I don't
See?
smoke. So
Yeah.
so even though I was suffering from fatty liver disease, because I
Okay.
was eating junk foods, I
Okay.
was eating, so I realized in my 35 to 40 that is something wrong in my body.
Body.
And majority of the people, when you are in colleagues, they started realizing, अब तो कुछ करना पड़ेगा, something is wrong with the body.
Yeah.
At that time, if you screen them, they always have a fat in the liver. No diabetes, no blood pressure. Fatty liver will come before you develop diabetes or impaired glucose tolerance,
Okay.
and it is before the blood pressure. Sir,
Right.
फिजिशियन ने बता दिया, फिजिशियन को दिखाया है और एक ब्लड प्रेशर का गोली चल रहा है, बट व्हाई डज ब्लड प्रेशर कम? यू स्क्रीन योर अल्ट्रासाउंड,
Exactly.
your screen or ultrasound,
Yeah.
ultrasound will show that there is fatty liver. So it is to begin with fatty liver, then your blood pressure, then your diabetes, then your heart attack, and then your stroke.
So it's a series.
Yes, series. So 20, 30, 40, 50, 60. But
Right.
somebody have early, they may be a variation in genetics that
Okay.
leads to early, or lifestyle. लोग रात को जगते हैं, तो simple, that is a
Yeah.
stress
Sleep
factor.
issues.
Yeah, sleep factor. So that can lead to development of this all problems.
So before going a bit 2 minutes back, you were saying that blood test should be done, diagnosing. I feel एक तो इंडिया में है ये प्रॉब्लम, इतने सारे टेस्ट क्यों करवाने हैं? अगर आप फाइब्रो स्कैन और 4-5 ब्लड टेस्ट लिख दोगे, उसमें से आधे लोग they will not do it. I think personally एक वो मैसेज भी जाना चाहिए कि प्रिवेंशन इज वेरी मच बेटर देन क्योर. सो व्हाई डोंट यू एक्चुअली ट्राई एंड गेट इट डायग्नोस्ड अर्ली और हैव अ रेगुलर चेकअप. वो पैसे ज्यादा अच्छे लगेंगे देन एक्चुअली स्पेंडिंग ऑन मनी.
So why you are sensitized about, because
Yeah.
your family
Yeah,
member
I've
is suffering.
had it.
So whenever patient comes first,
Hmm.
और मेरे को लगता है कि ये पेशेंट को फैटी लिवर डिजीज या सिरोसिस है, तो मैं पहला क्वेश्चन पेशेंट को यूं पूछता हूँ, आपकी फैमिली मेंबर में कभी किसी को सिरोसिस हुआ है?
राइट.
दैट पेशेंट इज मोर सेंसिटाइज्ड एज कंपेयर टू द अदर. सो जनरल पब्लिक में अवेयरनेस आने में तो बहुत ही टाइम लगेगा. इट विल टेक लॉट मोर टाइम to get awareness into the general public about liver disease, but I am pretty sure the way in which this all social media is going,
Exactly.
next 3 to 5 years everybody know, because now young generation are coming up. I am taking my
you have to take care of your
diet. No,
Yeah.
they are conscious, they are doing gym, they are doing diet conscious.
100%.
So I am seeing the change and shift. I am not going to eat the Gujarati foods like all food, fafra, jalebi, and everything, and
Indian
they are
food
conscious.
has it
Yes.
also.
So there is a drawback of Indian food, because we already know that what the work we were doing in the past and sedentary lifestyle right now.
Agreed.
So that is major responsible for this type of.
Agreed. So 2 things I think from taking from this is, first, you need to listen to your body, understand what your body is trying to say, and second, let's try and prevent it more than just actually going to the doctors and reaching to the surgical beds. Let's try and see कि पहले हो सकता है कि हमें regular checkups करने चाहिए. We should also try and listen to what our doctors are actually suggesting, because I've seen a lot of doctors who, like, you don't want to give medicines to the patients anymore. They want them to prevent it, because doctors have seen both the sides.
I think if I am not taking the medicine, why my patient should be taking medicine?
Exactly.
That is what I feel. And the most important, as you said, if they are looking at this type of social media content, they should get screened at around 25, 30, at least. When you are in younger age, at least 5 years, one body profile checkup is sufficient enough to give much more information, because you need not to go to doctor.
So let's summarize this in that way. If I am, let's go from 18 to 40, then how do you suggest, how often should I screen myself if I'm 18, and then if I'm 40? So what should be the range?
So I will recommend it at the age of 20, 25, 30, 35, at least 5 yearly check till the age you reach 40. And then after, for a simple blood investigation, which is your CBC, your liver function test, your renal function test, the vital organ function test. And after your age of 40, you need blood reports and ultrasound, blood reports at least yearly, and ultrasound at least 3 to 5 years. So that is what roughly for a general population should be getting.
We're healthy.
Yes, if for healthy individual.
Exactly, for healthy.
Yes, if somebody developing symptoms, they are going to get screened whenever they are visiting the hospital, because doctor is going to ask them.
For example, if somebody already has any other chronic disease, diabetes, or any other issue in their gut, then they should get screened or diagnosed, like blood test, earlier, more often than the healthier people. So somebody at least once a year, or if you're,
that is more frequent. So diabetes, what is the common age for diabetes? 40s, 50s, 60s are the common age for diabetes. We get a young population with diabetes. It is type of diabetes with genetic conditions. So that people are going to come early, because they have already developed symptom, then they're getting diagnosis of the sugar disease. but by and large common is for diabetes is 40-50. They should be screened at least yearly for
Okay.
every checkup.
Understood. Completely understood and agreed with it. So now let's talk about bit more about hepatitis, which is obviously directly linked to liver and everything. But I want people to actually understand what is hepatitis in very simple form and what actually happens, if you can give a bit of idea of what actually happens inside your body at that time.
So word
Hmm.
hepatitis
Hmm.
suggests liver. Titis means inflammation.
Okay.
So it is the inflammation of the
Liver.
liver. So whenever there is, what now you need to understand for general population what is inflammation in the body.
Yeah.
So inflammation means anything which is causing pain,
Hmm.
swelling
Hmm.
is called as inflammation. Inflammation can occur in any organ. It can occur in liver or body, joint pains, anywhere it can occur in inflammation.
Yeah.
So if the inflammation occurs, it is in the liver, it is called as hepatitis. So what are the types of hepatitis we are talking
Exactly.
about? So hepatitis means inflammation. We divide it in broadly category like acute hepatitis, जो immediate होता है, and a chronic hepatitis.
Right.
जो chronic है, जो धीरे 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 धीरे
Over
करके डैमेज
time.
होगा over a period of time. So more than
Right.
less than 4 weeks is an acute hepatitis. Chronic is more than 4 weeks hepatitis. So let's talk about the hepatitis. So the commonest factors which causes hepatitis is viral hepatitis.
Okay.
The virus that is commonly affecting your liver.
Liver.
That is the first cause.
First cause.
Second cause is alcohol related hepatitis.
Okay.
That is also quite common.
Hmm.
Third cause, the hepatitis is due to fat. That is what we are discussing right
Yeah.
from the beginning of the podcast. That is the fatty liver disease causing hepatitis. That is non-alcoholic steatohepatitis. Now new term for it, it is metabolism associated fatty liver disease. Everyone should know it is MASH. MASH.
Yes, MASH. That was gonna be one of my
Yeah.
upcoming questions. That
Yeah.
if you can define MASH, because I recently did another podcast, and I've heard this so many times these days as you were explaining MASH, that metabolic disorders in general are growing so much, and in the next 5 years, that's gonna be the biggest pandemic we're gonna have. Especially the kind of country and the kind of food our country has is going to be a bigger issue.
So we are already having pandemic. We are already
Yeah.
having pandemic, but we are recognizing it now.
Yeah.
Because newer and newer medicines are coming up, so that is more getting highlighted. We are already running
So we are
pandemic
in the
for
zone
last,
of
yes,
pandemic.
we are already for last 10 years.
Okay.
But we are now started recognizing it, and that is the why these things are coming up early, more often and more often.
Right.
So going back to our question of hepatitis.
Yes.
Okay. The first question I told you about viral hepatitis.
Exactly.
So everyone should know viral hepatitis, which are the causes of viral hepatitis. Monsoon season is going to start.
Right.
We are in July right now.
Yes.
So 20th July is celebrated is Hepatitis Day.
28th July, yes.
Yeah. So 28th July is celebrated because of the scientists who invented this virus,
Right.
hepatitis B.
Yeah.
The Blumberg.
Yeah.
According to his, in his memory, we celebrate this Hepatitis Day.
Right.
So this year the theme is let's break it down.
Yeah.
So that
It's
is
let's break it down.
So what is that hepatitis? Let break it down, because what we are doing right now is
we're breaking it down.
Breaking it down.
Breaking it down.
Okay.
Exactly.
So what is the first thing what you should is the hepatitis, the types of hepatitis. I simply explain in my OPD A, B, C, D, E. So 5 common viruses, the most common virus.
Right.
So hepatitis A and hepatitis E. These 2 viruses are transmitted by fecal-oral route. That means,
so you have to obviously simplify it.
simplify
A and E we are talking
A and E. We are talking about A and E.
Yes.
जो खाने पीने से होता है.
Okay.
Monsoon season, when you are taking food which is outside. So I always ask my patient, don't take outside food. पहले क्या होता था कि प्रैक्टिस में हमारे सर पूछते थे कि पूछे हिस्ट्री में outside food, तो हमको लगता था ये क्यों पूछ रहे हैं. But right now we am realizing if hepatitis A, if you are not eating outside food, you are not going to infected with
A and E.
You have to take food and whereas water, because basically food and waterborne disease.
Yeah.
So you have to this. Because the monsoon is coming up, we will start seeing the cases of hepatitis A and E. Now, what is hepatitis A and E? That means if you are going to get
Hmm.
taking food today, after 30 or 45 days you are showing symptoms of hepatitis. What are the symptoms of hepatitis?
Hmm.
That somebody will have a vague fever like feeling. You will feel like I'm getting infected with the virus. Body
Okay.
ache,
Normal viral.
nausea, vomiting, these are the
Hmm.
symptoms. So jaundice will appear late. These are the
Okay.
symptoms of prodrome. So initial 3 4 5 days we will have a body ache, weakness, fatigue, malaise, and
Hmm.
urine may start doing showing it yellow color before the
Okay.
jaundice in the eyes appears. By the time jaundice develops, patients start realizing that I'm affected with hepatitis. So this
Hepatitis
is classic picture of
A.
acute hepatitis,
Okay.
hepatitis A or E,
So A and E hepatitis comes under the acute
acute
version of
condition
it.
majority
Okay.
of the times.
Okay.
So uh, here the treatment, and once you reach to the doctor, they will give a symptomatic treatment.
Hmm.
But only 5-10% of the people will have a severe problem.
Okay.
So both the so if you don't eat outside, I can say in day-to-day practice it is very difficult that you
Hmm.
cannot avoid the outside food. Only my message, if you take
Hmm.
a hot food and
Okay.
clean water, okay,
Hmm.
so then you will be get saved by getting this
Yeah.
viral hepatitis.
Less chances of it, as
Yeah,
less as
yeah, yeah,
possible.
yeah.
Okay.
Now talking about hepatitis B,
C
C,
and
and
D.
D.
Hmm.
This viruses, acute hepatitis is slightly rare. Hepatitis B can
Okay.
cause acute hepatitis, hepatitis C, but it is very rare. Majority of the times they produces chronic hepatitis.
Okay.
Okay, so when does the hepatitis B? So everyone should be know what is hepatitis B, because it is a very common virus. It is
Okay.
gets screened. Yes, so hepatitis B virus, I can tell you the thing which is acute and chronic. And the
Hmm.
chronic, the how somebody get infected with hepatitis B.
Hmm.
The number one, I will say, any blood transfusion.
Okay.
So blood transfusion which is contaminated by hepatitis B
B
virus.
virus.
रूटीन इंडिया में स्क्रीनिंग चालू हुआ हेपेटाइटिस बी का
Hmm.
1980s में.
Okay.
So those who have transfusion or operations before 1980s,
Hmm.
they are likely to have hepatitis B in their blood.
Okay.
Number two, many of the times the previously syringe and needles were not disposable.
Yes.
So disposable syringe and needles. So you go in a community, when somebody in the doctor dispensary, if the previous
Hmm.
patient has been used and they were doing like a glass water heating and everything.
Right.
So that is responsible for hepatitis B outbreaks, hepatitis B virus.
That's interesting actually.
Yeah.
That I don't believe a lot of doctors would spread it like this, that before 1980s वालों को तो होने के chances are
है
है
ही.
ही if they've
So
done
they
a
should be
transfusion.
get screened for hepatitis B and C
Hmm.
both, because C का चालू हुआ 2001 में.
Right.
So routine screening
हाँ,
in India.
routine screening.
So everybody, those who are getting operated before or have a blood transfusion before this years, should be get screened for hepatitis B and C, because hepatitis B and C और वो immediate symptom नहीं करने वाला है, वो
It's a
एक
silent version
silent disease.
also.
After now मैं बताऊँ कि hepatitis B and C, how does, we will discuss the symptoms later, symptoms, what the symptoms they
Yeah.
present with. But what happen if we have a cure for hepatitis C, and in case of control hepatitis B, because we directly see patient present with the something like liver tumor.
Yes.
Okay, so I will discuss you first about how the chronic hepatitis behaves. So if I am getting infected with hepatitis B today, I will not have any symptoms for initial 5-10 years.
10 years.
Yeah. If
That's a long time.
If my immune system is capable enough at the first entry to handle the virus, then I'm not going to develop symptoms. If it is not capable enough or it fights, then it develop acute hepatitis B. But those who are develop acute hepatitis B, they are lucky. They clear the virus 90% of the times.
Right.
But if you say chronic, if they develop chronic, within 5, 10, 20 years, they develop repeated inflammation, the damage in the liver,
Okay.
hepatitis, inflammation correction, that leads to scarring in the liver and fibrosis means liver का कड़क हो जाना, अगर
So
सूख जाना,
stone shaped kind of.
not a stony hardness will develop when the patient develops cirrhosis.
So slowly towards that.
Slowly it will be that. If you think your tree, the stem of a tree getting drying out
सूख
and
जाना
becoming
किसी चीज
सूख
का.
जाने का, तो
तो उसका
liver
हाइड्रेशन इन शॉर्ट चला गया है
चला गया,
धीरे
उसका
धीरे।
स्टोरिंग कैपेसिटी, उसका फंक्शन, वो सब चला
हम्म
जाता है। सो ओवर अ पीरियड ऑफ 5 to 10 years दे डेवलप फाइब्रोसिस। वो फाइब्रोसिस को हम बोलते हैं F1, F2, F3, F4 फाइब्रोसिस।
ओके,
और जब F4 फाइब्रोसिस होता है उसको अपन बोलते हैं कि सिरोसिस हो गया।
so it
सो
comes again like a series. Hepatitis, then you get your liver
हाँ,
dries
फाइब्रोस
out, and
ड्राइज
then
आउट
you go fibrosis,
फाइब्रोसिस।
and that also has 4 stages in it.
या
The last stage, that means completely it's liver cirrhosis.
is cirrhosis. Why
Okay.
it is cirrhosis? It was potentially was considered to be irreversible, and the fibrosis state are considered to be irreversible. But
Okay.
nowadays we have seen with the advancement of treatment, even somebody develops cirrhosis, we can have some reversibility
So it
potential,
is reversible
some
till a point.
reversibility potential with certain
Hmm.
medicine and certain particular disease.
Hmm.
And thereafter 5-10 years we develop liver tumors. So
Okay.
very common, hepatitis B and C developing liver tumor. Even if I've treated hepatitis B and C patient, 5-10 years down the line they come up with the ultrasound report, you have liver tumor. So hepatocellular, because जो टिश्यू स्कार हो चुका है, ड्राई हो चुका है, उसमें
It's difficult to
ट्यूमर
get
कैंसर होने
completely
की संभावना रहती है।
reverse.
तो
Yes.
लिवर कैंसर का भी इतना इंसिडेंस होता है। सो दिस इज अ स्पीरीज ऑफ द स्पेक्ट्रम फ्रॉम
Yeah.
हेपेटाइटिस। नाउ we told about hepatitis B and hepatitis
C.
C. Both has a different pattern of presentation,
Okay.
but over a period of time both can cause this type of sequelae.
Okay.
Hepatitis D कभी alone नहीं होता है, वो hepatitis B को साथ में लेके ही घूमता है।
Oh.
So it can alone, it can never harm. So if you screen for hepatitis B, no need to screen for hepatitis
C.
D.
D.
And
Okay.
hepatitis E we have already covered. So
Yes.
to make this all, these are called as a viral hepatitis.
Viral hepatitis.
Now second hepatitis we are talking about fatty liver disease.
Yes.
Again fatty liver disease. So what?
Sorry, just to understand, as far as I have knowledge, there is a vaccine for some of these hepatitis also. So, can you tell us a bit about which hepatitis has a vaccine and you should be taking it?
Are you vaccinated with hepatitis B?
I think I am. I'm not sure because I'm
No.
born in 2001.
So 2001, where the routine screening of blood reports are become mandatory for hepatitis B.
Okay.
And I think those around 2005 afterwards,
So they would
has
be.
been vaccinated for hepatitis B as per government protocols.
Okay.
But before that, those who are born like us, they are not vaccinated for hepatitis B.
So we should be more careful.
Yes, so everyone listening to this podcast should have they are vaccinated for hepatitis B, irrespective of they have any disease or not.
Okay.
And if they should get screened for HBsAg, that is a simple blood test, hepatitis B, HBsAg, and then should be vaccinated for hepatitis B. It is very cheap vaccine. It has to be taken intramuscular into the 3 doses, 0, 1 and 6. That is
Okay.
of three doses. So
Three
it is only a
repetitions.
100 rupees vaccine.
Huh.
So 100 or 200 at the max.
But still, people wouldn't have taken it.
And there
That's
is
the
no
thing.
side effects like other vaccines that we have.
Yeah, so fever or something that is not common in that.
Every patient should be vaccinated for hepatitis B. So that is a core message from this.
Okay.
Other vaccines, hepatitis A and E, that is not routinely prescribed vaccines, and
Okay.
that is also a simple 2-dose vaccine. Hepatitis A still it is given in the pediatric age group, not started giving
Okay.
by the pediatricians in younger age. And hepatitis E vaccine is still evolving in India. It is just launched in 6-12 months back.
Okay. E.
So there are 3 only vaccines available. I think if you don't take all 3, only the key is hepatitis B vaccine.
Because it already brings hepatitis D with it, as you said.
Hepatitis D is not a major concern right now, but
Okay.
at least everyone should know about
Hepatitis B. So, as you're talking about the viral ones, I also want to break out a bit about the stigma that people have with it. कि अरे वो उसने वो utensil छुआ है तो भी मुझे हो जाएगा, या फिर वो खाना pass on किया है तो भी हो जाएगा. So let's break it down. The common ways it can pass on.
So the common ways the hepatitis will pass on only when there is a blood to blood direct contact.
Exactly.
If I have get some tear in my means some scratch in my hand, and if the blood is oozing and somebody person has already scratched and oozing a blood, if that two got contacted, then and then you are going to pass the hepatitis B.
Okay.
Otherwise, tattooing is common. Dental procedures are the common. If the dental instruments are not been sterilized properly, then you get hepatitis B.
Yeah,
common.
very easily that is possible.
Tattooing or any intervention, not only dentistry, but
Any surgical
medical or
processes.
surgical procedure, if the instrument is not getting. So these are the ways you can get acquired for hepatitis B. But nowadays, all these things, the procedure related are getting decreased. Another subgroup of patient, kidney patients on dialysis, they are also frequently getting infected with
Again,
hepatitis
because
B because
so
of the blood
something that
contact.
that is going inside your body can cause this.
So
It's not
touching,
like,
not
yeah.
going, not going to get in problem.
Okay.
Obviously you cannot share the shaving razors like
Hmm,
thing,
hmm,
the
hmm,
which is going to get
hmm,
cut producing this,
hmm.
or if you are doing a brush that can produce trauma inside, and if somebody is
Right.
using the same brush. So these are the things that should be carry on.
Hmm.
Otherwise there, साथ में रहने से नहीं होता है,
हाँ,
साथ में खाने से नहीं होता है. So that,
यूटेंसिल्स एक दूसरे
हाँ,
के यूज
और
करने
ये
से.
इसको हेपेटाइटिस बी है तो मैं उसके साथ नहीं रहूंगा, दैट
हाँ,
इज
मैं उसको
वेरी,
टच नहीं करूंगा, एक वो स्टिग्मा है
है है
हमारी कंट्री में तो है
है.
कि नहीं होगा,
इसीलिए
मैंने
लोग
उसका
बताते नहीं है कि मेरे को हेपेटाइटिस बी है.
हाँ.
Many of the times when patient comes to us for endoscopy, they
Yes.
don't tell, because government has not a system that is that every patient is linked to this. If they
Hmm.
don't tell, we won't be able to know I'm suffering from. See, if you are already diagnosed with hepatitis B, you should tell your doctor that you are suffering
Exactly.
from hepatitis B, so the next patient
Yeah.
is not going to get infected.
There needs to be a holistic approach.
Yes.
अप्रोच जहाँ लोगों को ये भी समझ आए कि हम आपके स्टिग्मा को भी कर सकते हैं ठीक.
हाँ.
इट्स नॉट नेसेसरी कि आप एक डिजीज लेके आए हो तो डॉक्टर या कोई हॉस्पिटल आपको सिर्फ उसी के लिए क्योर करने वाला है. एक होलिस्टिक अप्रोच लेके आजकल लोग ज्यादा चलते हैं कि उनका क्या सोच है, उनकी मेंटल हेल्थ पे भी क्या इफेक्ट आ रहा है. इट हैज बिकम अ होल सर्कल नाउ. पहले वो था कि एक ही साइड से हम सोच रहे थे कि हाँ डॉक्टर को क्या लग रहा है. नाउ इट हैज बिकम अ होल सर्कल कि हाँ पेशेंट कौन सी और चीजों के साथ भी जा रहा है.
So that is most that you should avoid. Family counseling is most important when you are considering
Suffering
this.
to this.
And simultaneously family screening, that I've forgotten to tell previously, the family screening is also important. So any patient who are already hepatitis B positive,
Right.
every family member needs to screen for hepatitis B.
Hmm.
उनके मम्मी पापा, उनके भाई बहन और उनके बच्चे सबका हेपेटाइटिस बी का स्क्रीनिंग होना ही चाहिए.
Everybody.
Because maternal to fetal transmission is one of the
Main causes.
main cause of hepatitis, one of the main cause of hepatitis other than the blood transfusion.
Mother to kid.
What we were discussing is hepatitis. We discuss about the viral hepatitis. Second hepatitis, one hepatitis is alcoholic hepatitis. So we are putting alcohol aside right now, and the important is fatty liver disease.
Okay.
So fatty liver disease, I told you, the fatty liver disease, when it is 20s to 40s, you are developing fatty liver, progressive inflammation, scarring, fatty liver with inflammation, that is called as non-alcoholic steatohepatitis or metabolism associated steatohepatitis. MASH. Inflammation बारी बारी होगा, liver will shrunk, scarring, fibrosis, and then leads to cirrhosis.
Right.
So this is a pattern of fatty liver. Same way as a viral hepatitis B and C, this pattern is of fatty liver disease. So then comes which time patient presents to you.
Yes.
And that needs a treatment armamentarium. So as we discussed, hepatitis B and C has a treatment. Hepatitis B, simple medicine, but lifelong medicine.
Okay, so now let's go to the fatty liver side of part of the liver. Now we've discussed hepatitis, so let's discuss a bit more about how fatty liver can be subgiven and how the sections are.
So fatty liver disease, I told you, is initial begin with fatty liver. फैटी लिवर जब लंबा टाइम रहता है तो उसके बाद फैट में इन्फ्लेमेशन होता है, एंड दैट इज प्रोड्यूसेस मैश और नैश, दैट इज मेटाबॉलिज्म एसोसिएटेड स्टीटोहेपेटाइटिस. जब भी अपने एसजीपीटी बढ़ता है, तो जब लोग एसजीपीटी ऑलरेडी ब्लड रिपोर्ट में लेके आते हैं, तब ऑलरेडी दे आर पासिंग थ्रू वन ऑफ द स्कार इन द लिवर.
Okay.
Every inflammation will carry out the scar. They will end up with the scar in the liver.
Okay.
So over a period of time, they develop fibrosis, and fibrosis leads to a cirrhosis. So there is a continuum.
Again a series.
That is from the fatty liver disease to a development of cirrhosis.
So both the side has its own series, of course, plus both the side has silent symptoms in the start.
Yeah.
So it is going to take months or years for you to figure out if you wait for the symptoms.
So initially you will be asymptomatic. Then there is a blood changes, that is SGPT only, that is going to get up and down.
Right.
And then your clinical symptoms. Now what clinical symptoms will patient have fatty liver disease?
Fatty liver.
जब उसको cirrhosis होता है तब मालूम पड़ता है, तभी आते हैं.
That's literally the end stage,
एंड
मतलब.
स्टेज. ओके, सो बट दे विल प्रेजेंट इट.
Yeah.
हमारे यहाँ तो क्या होता है कि पैर में सूजन आता है ना. व्हाट इज द कॉमनेस्ट सिम्टम एवरीवन शुड
Yeah.
नो?
Yeah.
पैर में सूजन आना.
हाँ.
पैर में सूजन है ना, यानी आपके दिमाग में चलना चाहिए कि एम आई नॉट सफरिंग फ्रॉम सिरोसिस. पैर में सूजन आना यानी 3
It's the
causes.
biggest sign.
Yeah, it's a biggest sign. I'll say
Okay.
3 causes you have to work up whenever there is a edema fit. It's a simple thing. रोज अपना फिट देखते हो,
हाँ
edema
हाँ
fit है.
हाँ.
मैं पेशेंट को बोलता हूँ कि 3 कॉज तो आपको रूल आउट करना है. द फर्स्ट थिंग इज माय लिवर इज राइट और
Wrong.
wrong.
Yeah.
Second, your heart is right or wrong,
Okay.
and your kidney is right or wrong.
So
So
3 main
three
organs are
main
directly
organs,
linked with your
yes, edema.
feet.
बाकी सब cause होते हैं वो 5-10% में होते हैं, but majority of the patient either wrong with these 3.
But can you explain a bit why in the feet?
It is a dependent position, na? Gravity. It is because of the gravity when you stand up. So what happens? All these 3 condition, your body is started retaining sodium. Whenever there is a sodium retention in the body, it causes edema fit. Edema fit क्यों? क्योंकि हम लोग स्टैंडिंग पोजीशन में होते हैं. पेशेंट क्या बोलते हैं? मैं सो जाता हूँ, सूजन चला जाता है. दूसरे दिन जब चलता हूँ और वो मैंने ट्रैवल किया उसकी वजह से सूजन आया. तो मैडम आपको या सर आपको
नॉर्मल नहीं है.
15 साल पहले ऐसा नहीं होता था.
हाँ.
अभी क्यों हुआ है कि मैंने ट्रैवल किया और सूजन
या
आया?
आपके एज ग्रुप में तो सबको नहीं हो रहा है ना.
So your body started retaining sodium. And what is the cause of that sodium retention? Either in the heart or this problem. और क्या होता है कि हाइपर पेशेंट समझता है मेरे को ब्लड प्रेशर है. Physician will prescribe the treatment which excretes sodium in the urine.
Okay.
So 3-4 साल तो पेशेंट को ऐसे ही निकल जाएंगे कि आपको मालूम नहीं. इवन आफ्टर डेवलपिंग एडिमा 4 साल तो ऐसे ही निकल गए कि ब्लड प्रेशर की वजह से आपको सूजन है.
मतलब डायग्नोस ही इतना लेट हो जाता है ये दोनों डिजीज के हम
तो फिर
ट्रीटमेंट तक
मॉडिफिकेशन तुम लाइफस्टाइल मॉडिफिकेशन कब करोगे? आप 5 साल बाद करोगे तो
56 डेज में
एट
पॉसिबल
दैट टाइम
नहीं है.
पेशेंट का एक्सरसाइज करने का जो एफिशिएंसी होता है
या
वो भी कम हो जाता है.
हाँ 100%.
सो की पॉइंट, एवरी एडिमा फिट जो भी पेशेंट को पैर में सूजन है उसको लिवर, हार्ट और किडनी का स्क्रीन पूरा करवाना चाहिए इंक्लूडिंग
Now
अल्ट्रासाउंड.
I have a reference for this. My grandmother, she has swollen feet. बहुत सालों से उनको ये इशू है. बट हम उनका जब भी ब्लड टेस्ट करवाते हैं कुछ आता नहीं है. Liver is usually normal. She has thyroid but.
Yeah. So I told you rest of the 10% are other causes of edema fit.
Okay.
But have you done her sonography?
Sonography maybe not. We have done blood tests.
So blood test is that is what I
Okay.
want to convey na. Sonography
Sonography भी
is
होना
not
चाहिए.
sufficient to diagnose all the causes.
Okay.
So you have to screen for her liver. आपने उसका 2D इको करवाया, मींस हार्ट चेक करवाया.
हाँ हार्ट इज फाइन.
हाँ नहीं 2D इको होना चाहिए. फंक्शन ऑफ द हार्ट शुड बी द इनफ.
Okay.
And kidney function can be reasonably good tested with the blood reports. Okay, so these 2 organs where there is a test like fibroscan or 2D echo that will help to look out the causes of edema fit. But then after if you have investigated कि 3 cause मैंने rule out कर दिए हैं, so I am happy that it is I am not dealing. Sometimes blood pressure medicine common amlodipine चलता है तो भी पेशेंट को सूजन आता है. हाँ. वेरिकोसिटी होता है लेग्स में तो भी सूजन आता है. या वेरिकोसिटी होता है तो भी सूजन आता है. As you told, थायराइड होता है तो भी सूजन आता है. बट रेस्ट ऑफ द कॉजेज आई पुल 10% उसमें पेशेंट को कुछ होने वाला भी नहीं है. हाँ. और दे आर नॉट गोइंग टू मच बॉदरसम. बट दिस 3 हैज टू बी स्क्रीन.
नाउ विद फैटी लिवर, अगर आपको कोलेस्ट्रॉल हाई आता है, LDL, HDL, how often is that directly linked to high level of fatty liver?
So this comes to the concept of metabolism associated fatty liver disease.
MASH again.
I told you.
Huge highlight today.
Yes, MASH. So 5 pillars or 4 or 5 pillars that I will tell. The first is obesity. Okay. So everyone, those who are suffering from obesity, you know about body mass index?
Yeah.
So you
BMI.
know about body mass index. Every person who are listening to the podcast may not be aware.
So BMI is a short form जो लोगों को usually पता होता है कि आपको अपना BMI पता होना चाहिए basic.
हाँ. So height और weight उसके हिसाब से अपन BMI calculate easily calculate कर सकते हैं. So that BMI over 25 इवन इन 23 से अबव होता है, 25 से अबव होता है. हमारे में ओवरवेट बोला जाता है 25 to 30 को. 30 के अबव होता है उसको ओबेसिटी बोलते हैं. हाँ. सिंपली किसी को BMI नहीं होता है तो उसका वेस्ट सरकमफरेंस जो हम 32, 34, 36 जो बोलते हैं कमर पेन का
Especially in men in India have a huge belly.
belly. So that type of waist circumference is also a marker of you are suffering from obesity. That is one. So first is obesity. Second is lipid abnormalities.
Okay.
That is lipid abnormalities in the form of dyslipidemia. It is called as dyslipidemia.
Dyslipidemia.
Third is your blood pressure.
Okay.
So your blood pressure, that is when you recommend standard blood pressure guidelines, what we know is 120/80, 140/90 above, it's called as a high blood pressure, but that is preclinical hypertension and hypertension.
Okay.
So you have obesity, you have a dyslipidemia, you have a blood pressure. If you have a high uric acid levels, uric acid, so that is a part of your all part of a metabolic syndrome. And along with this, top of it is fatty liver. So whenever you have fatty liver with blood pressure, fatty liver with lipid abnormal,
Right.
fatty liver with obesity,
Right.
so and fatty liver with sugar. So that is one part sugar already. So diabetes. So fifth pillar is diabetes. So anything with fatty liver and any of this combination.
And somewhere all these diseases also come from metabolism. So
this is
MASH
all
is
metabolism. So this is all
huge
all
thing.
about metabolism associated fatty liver disease.
Right.
Okay. So any of this parameter, are you suffering from obesity, your lipids are high, your blood pressure, your diabetes, uric acid high. So all these things are linked to a metabolism associated fatty liver disease.
Okay, so now because this is fatty liver, so fat is a huge part of it. Nowadays, a lot of people take Ozempic, GLP-1s, Monjaro, and this and that. A lot of people and a lot of doctors also say that this can help you with the fat. So individually, it will help you with the fatty liver. How do you think that works with the upgraded versions?
So if you compare, I'm talking about the classical man or woman who are coming with the age of 40.
Yeah.
So 40, if they are obese. Okay, so somebody is obese and somebody is having blood pressure. So blood pressure में वो medicine लेके blood pressure का, ठीक है? डायबिटीज में वो मेडिसिन लेके डायबिटीज का, लिपिड में बोल रहे हैं वो मेडिसिन लेके लिपिड का. If I want to treat all these three with the one molecule, then
so three chronic diseases.
Yes, 3 chronic diseases. So all these things, the one molecule, then these newer molecules are what you are talking about, Ozempic or semaglutide or Mounjaro,
GLP-1,
tirzepatide or other molecules are there a lot more in pipeline according to this.
Yeah,
so they are called as metabolic modulators. So these drugs are going to work. I'm hoping they are working. Means I've started using in its practice. They are working well. But the problem with these medicines, we already see a lot more social media content that this medicines causes is the weight loss, but simultaneous muscle loss.
Yes.
So every person should have lifestyle modification first. I ask them, मेरी ओपीडी में आप 1 महीने 2 महीने 3 महीने बाद आना, बाद में मैं मेडिसिन चालू करूंगा. फर्स्ट यू स्टार्ट योर लाइफस्टाइल मॉडिफिकेशन. If you cannot do exercise for 1 hour and if you cannot take your diet control, don't ask me about any injections.
That's a very good way to approach it.
Injections are shortcut.
Yeah, it's a shortcut.
Shortcut. So don't ask. पर कोई पेशेंट ऐसा है, सर मैं 2-3 days back, young woman, you have a back of the nape. Have you seen the nape of the neck is getting black?
Insulin
that is a
resistance.
part of insulin resistance of the metabolic syndrome.
The
so I
blackness
always
around
see
your
nape of the neck in my OPD practice.
Right.
Okay. So if it is black, that suggests acanthosis.
Yes.
So that is part of insulin resistance.
Yeah.
The females especially have menstrual irregularity and PCOS. It's part of
PMOS is very common. It has also been linked to metabolism now.
So it is also part of metabolic
disease.
So all young, the 4 days back, a young girl came with this symptom. She was over. सर मैं रोज कांकरिया लेक पे 5 किलोमीटर दौड़ती हूँ. I am doing my diet control.
Still no change.
I am treating treatment from the skin people, but something is wrong. So these are the candidates where they have already done an all effort. Yeah. And she wants something for her body. Yeah. Then these are the injections should be selected.
I relate so much to this. I have personally suffered through PMOS, and in the era in India where people did not even knew about PMOS, young girls usually don't know, and the doctors 6-7 years back, they had no idea. They were only saying, "अरे weight loss कर लो, पर हो नहीं रहा है weight loss, हमें करना है." For these kind of people, GLP-1s are great.
Yes. So yeah, explain about the patient for diet and lifestyle modification. First, ask them to go to gym for a strength training. If these two criteria is fulfilled, then they are eligible for this injection. If I'm asking to somebody who has severe problem with their knee diseases
Yes.
and something, then they
Yeah.
could do diet and
Physical
directly jump to
inability.
these molecules. But I can see in a 3-5 years or 10 years horizon, these molecules will be a game changer for country like in India.
Yeah, especially when we have so many people who are obese plus so many people who are diabetic. So that comes hand in hand also somewhere. So that is for them, this is going to be a very big thing to reverse a lot of things. So that's a huge thing. Let's talk a bit more about technologies. Now we've talked about hepatitis. Now we know about fatty liver and disease. Now with today's AI generation, upcoming drugs as we talked about GLP-1s, what do you think? Can AI, as we were talking about prevention, diagnosis, can AI actually help us diagnose it or understand it better?
110%, there is no doubt about it.
Mm-hmm.
AI is going to become a game changer. How
Okay.
it is going to change? Suppose it will be easier. For the first thing, what happens now? Patient comes with the already search in ChatGPT.
Yeah.
So they come with the search in ChatGPT.
Mm-hmm.
AI will what tell? It will give me an image. So fibroscan, when we are doing personally, they will give an image. So this is the score. That is easier.
Yeah, it's easier for them to also
For if we
understand.
do endoscopy, it will be easier to identify the lesions. It
Okay.
will bip. There is some lesion. You please see carefully.
In case your eyes don't see it, then AI will definitely catch
Yes,
it.
yeah. Your mind is roaming around, but AI mind may not be roaming around.
Of
So
course.
it will be targeted. So if we
Yeah.
have taught enough and if data, so
Mhm.
definitely it is going to. Or simply if the patient is going to upload blood reports, doctor
Hmm.
findings and everything, AI is going to tell you diagnosis. So
Right.
it should be, and by the time as goes, they are AI machines. We are going to have a more and more mature machines.
Machines, yeah, of course.
So that will help and shorten the duration and bridging the gaps. Though what the bridging gap is from diagnosis
To
to a
treatment.
treatment, those gaps will be a bridge by an AI.
So you can use it in a better manner instead of actually taking it against
No, I am
the.
not
Yeah.
against at all. I am totally in favor of this because it
Mhm.
saves the time lot more
Exactly.
and it helps always. It is your assistant. It may not replace you, but they are taken as very well
Hmm.
assistant.
So it can actually not just help the patients, also the doctors, as you were
Yes,
telling
yes,
about
yes,
the
yes, yes,
endoscopy and
yes,
all.
yes, yes.
So we should actually leverage it more
Yeah.
instead of taking it कि ओ AI हमारा सब कुछ ले लेगा
No, no, no,
हमारा
no,
job भी
no.
ले
It
लेगा
is
सब ले
going to help it. So
Okay.
newer jobs are going to
Yeah,
get
I mean, of
created.
course, it's not like AI will train itself. No, you will need doctors or people who will train AI to understand that also. हर चीज तो लिटरेचर से भी नहीं सिखा सकते हम उसको ट्रेन भी करना पड़ेगा थोड़ा
हम जो हमारे जूनियर्स को सिखाते हैं वही चीज
हम
AI को
AI
हम
को सिखा रहे
सिखाएंगे
हैं अग्रीड
and they will work at our time. They will work at our time and will be more alert every time in any time of a day.
एग्जैक्टली
That is
एंड डू यू थिंक एज अ डॉक्टर हम यू हैव सो मेनी पेशेंट्स आई एम श्योर तो हम पेशेंट्स को शायद उतना समझाने का टाइम नहीं दे पाते तो एआई से हम उनको गाइड भी कर सकते हैं कि आप एक बार एआई को ये डाल के
मैं
देखो
हमेशा मेरे पेशेंट को लाइव कंसल्टेशन में ही बोलता हूँ,
राइट
डू यू नो दिस व्हाट इज प्लमर विल्सन सिंड्रोम यू आर सफरिंग फ्रॉम.
ओके
पेशेंट सामने है, वो गुजराती जानता है, वो हिंदी जानता है, नहीं जानता
हाँ
है. आई आस्क देम, आई हेल्प देम टू एंटर
on the AI.
AI,
Exactly.
put it them, give them,
Whatever
just
language they
sit for
want.
5 minutes outside, read everything and then come to me, and over and above that questions you have, I will going to answer. So that is where I've changed
Right.
my practice.
Exactly.
I ask them, you just go tomorrow. I talk about one patient, I've explained them about injection. The cost of injection was 65,000,
Okay.
but the side effects were less. So next day he went back. Next day I received a call, sir, I want to take that injection.
Because he studied about
I asked him, how did you
decide that.
convinced about the injection? Okay, I helped with the ChatGPT and AI. My work was done by ChatGPT and AI.
So it
it
can
was
actually help fasten the whole process.
so much. I'm happy. The counseling and even sometimes complications related to the procedures will be easily understood by the patients. Yes, these are the complications. It is
उनको
not
समझाना इजी हो जाता है
बहुत.
और वो समझ के आएंगे तो उनके पास एक्चुअल क्वेश्चंस होंगे
Yes,
अपनी
yes.
बॉडी को डिजीज को लेके वो समझे बिना आएंगे तो हमारा टाइम उनको समझाने में ही
जाएगा.
इट
Well,
विल गो
sometimes if they want a second opinion, they always take a second opinion from there.
yeah
That is easy.
it's common in this
No, AI will act as a second
yeah
opinion for
it
us.
will completely now from AI let's talk about because industry में तो बहुत सारे changes हो रहे हैं the whole healthcare industry in general is changing a lot coming from a doctor's perspective, what do you think Indian healthcare जो सिस्टम है वो कैसे थोड़ा और अपग्रेड होना चाहिए ताकि हम पेशेंट्स आर द सेंटर फॉर इट? कहीं ना कभी वो ऐसा हो गया अभी कि डॉक्टर्स के पास एक एक डॉक्टर के पास देयर आर सो मेनी पेशेंट्स, उनके पास समझाने का टाइम नहीं, तो एक वो गैप आ जाता है. हाउ डू यू थिंक दिस गैप कैन बी फिल्ड? हाउ द इंडस्ट्री नीड्स टू स्टार्ट अगेन रिवॉल्विंग अराउंड द पेशेंट्स?
So what I feel, the suggestion, the first suggestion, the government has already started ABHA, that Ayushman Bharat Digital Health Mission.
Okay.
Okay, so linking one patient,
Hmm.
if they are roaming around in a city to
Hmm.
one doctor to another, another to another,
Mhm.
but their data is fixed. They are exposed to this. So that way we can generate Indian population data.
So whole
Number
data
one.
in one place.
Yeah, so that is the greatest advantage with the digital thing. And India is
Hmm.
like the Aadhaar card, which was we were seen in the past. We have seen in the past they have linked. Now every person will have an Aadhaar card. So
Yeah.
that is going to come. Everybody has an health ID. Like other
Exactly.
countries, they will have a
Yes,
unique
for
health
example,
ID.
US has OCI cards.
Yeah,
It's
yeah.
very similar to that.
That.
And I'm
So,
sure not a lot of people have done it or use
yeah,
it either right
yeah.
now in India.
So this is if this comes and established, I'm happy. That is one thing.
Okay.
Second thing, the system, the whatever available. Say if there are one person is saying 40 patients in a day, so you cannot trade.
It's not fair to the doctor also.
Yeah, so I think the system needs to upgrade 10 to 15. So why this, how this is possible? Everybody paid in a good amount,
Yeah.
or the working in a system. Then
Hmm.
if you see a 10 to 15 patients, I am damn confident the quality of medical care will going to improve
Exactly.
much more if the
Agreed.
numbers of the patients are seen to be less, because majority of the mistakes occurs when you don't spend the time with the patient.
Yeah, 99% of the mistakes, I
Yes.
feel. Being also, I feel that not just the amount of patients, it's also the availability.
हाँ.
In general,
नहीं, we
दूसरे
have
लोगों
in
की भी.
India we have enough number of doctors,
More than
and
enough.
more and more numbers are in production.
We have enough technology also. There is no tech.
Yes,
पहले
yes.
आज से 7-10 साल पहले था कि हाँ इंडिया के पास टेक्नोलॉजी की कमी है. There is no technology issue. We have equally the technology and the medicines available as any other
So
country.
when I came to Ahmedabad, there were 10 gastroenterologists,
Oh,
15 gastroenterologists. Now it is
just 10.
115.
115.
So 10
So
times rise in last 10 years.
that's a huge number.
Yeah,
10 to
so
115.
yeah, so I think the number of doctors are that. So patient is going to get a quality care.
Hmm.
I'm going to attend you much for a better way, because I have
Right.
not so many patients are sitting behind.
Yeah,
So there
of
is always a
course.
stress. So these 2-3 things I can see in Indian medical setup, if gets changed, that can.
Then it's
So
unbeatable.
we are good for pharma point of view. We are already a good hub.
Exactly.
We are supplying other countries, so we are up to the
Huge.
mark in pharma.
Yeah.
I think the medical interaction becomes good.
Hmm.
One thing, and second, the digitalization of the data. So
Yeah.
these things I think.
Especially with the AI, it's going to be easier if it's
Yeah,
digitalized.
yeah.
It's going to be very easier. Also, from a doctor's point of view, how do you keep yourself updated with the upcoming new researches or the new developments in your sector?
So right now, if I'm doing clinical practice in my family life, so I get very less time to getting updated. The
Yeah.
majority of the things are we attend conferences.
Yeah, CMEs.
Because you attend for it 48 hours or 24 hours, and you get update of whatever happened in last 3 months, 6 months or 12 months.
Okay.
Because of the global, so last 2-3 times I've attended the conference from the people who are coming from Harvard. So we are getting exposure to that type of faculties.
And now India has a huge exposure internationally.
yeah.
Medical
So,
tourism is also a huge thing.
and the Indian brains are sitting in a Western
Yeah.
country. They are always happy to help the Indian people.
100%.
Yeah, so we are lucky to have these people there, and they are teaching us very nicely. So conference gets
It's a
an
benefit
upgrade.
to have doctors there also.
Plus, it is very easier thing. Whatever comes to my mind, even in front of patient, I search on the
Yeah.
Google or ChatGPT. Just wait. Let me
Exactly.
see the dose. Let me see everything. Then I'll going to prescribe
So
it.
you as a doctor also use AI
And
for your leverage.
Patient has started accepting it. पहले क्या
That's a
होता
huge
था
thing.
कि बाहर घर पे जाके बात करेंगे कि
हाँ.
डॉक्टर ने को देख के उसने बाद में दवाई
बात
लिख
देख
के
के
दिया.
उसको आता ही नहीं
Now,
है.
now the patient has started
Yeah,
realizing
yeah.
whatever is done, it is good in good faith.
I've seen this with a lot of doctors, even bigger names of doctors. They've comfortably used. They tell their assistants, and they themselves search. Okay, let me see which medication I can combine with this.
Yeah.
Because we need to understand they are humans.
Yes.
They are allowed to make mistakes too. They have mental drain. They have burnouts too. It's not possible कि सब कुछ हम डॉक्टर पे छोड़ दे. हमको कुछ नहीं करना है. हम
Luckily, you
बैठेंगे.
understand the doctors. I'm happy that you understand the doctor.
I feel we need to put both the centers in the place. अगर डॉक्टर्स को पेशेंट्स को समझने की जरूरत है तो पेशेंट्स को भी इक्वली डॉक्टर्स को थोड़ा समझने की जरूरत है.
नहीं, no, I think patients are also
Getting
under,
there.
yeah, in that direction.
Yeah, agreed. Okay, now let's do a rapid fire. So I'll ask you back to back some questions. You can answer whether it's a fact, it's a myth, or if it's something that it depends and you can explain it. So the first one, lemon water detoxes the liver.
It's a, for detoxification you cannot use lemon water as this, but it 100% it is an antioxidant, will benefit your liver.
So fact somewhere.
Yeah, fact.
Somewhere fact. Okay. Normal liver enzymes means a healthy liver.
No.
Oh.
100% no.
Okay. Can you explain that a bit?
Yeah, because majority of the patients when they present with cirrhosis, their enzymes are normal. So
Okay.
when because liver does not left with hepatocyte
Okay.
to secrete these enzymes.
तो एंजाइम्स
पूरा लिवर
नॉर्मल है.
सूख गया है,
हाँ तो
उसके
एंजाइम्स
बाद
ही कैसे होंगे?
हाँ तो एंजाइम तो कैसे आएंगे?
ट्रू.
So it is not always.
Okay.
It may point injured liver point, but one trial does not suggest that you are not suffering from cirrhosis. You can suffer from cirrhosis.
Fatty grade 1 fatty liver is harmless.
100% no.
Okay.
Grade 1 fatty liver, you search what the wrong in body, what the inflammation, obesity, diabetes, blood pressure, anything I'm suffering from. So I strictly say grade 1 fatty livers, red alarm.
Okay.
First alarm.
Red alarm. First alarm. Your first warning.
First warning.
So coffee can support liver health.
Agree, 100% agree.
But what type of coffee?
So preferably without sugar.
Black coffee?
Yeah, that is preferred without milk. So without sugar and without milk, that support liver. But it should not be used as a therapeutic modality.
Yeah.
Your lifestyle modification will be, if I say 100% I want to treat my fatty liver, then 90% is diet and lifestyle, 5% is medicine, 1% is coffee.
Okay, but so at 1%,
yes, that
effect is there.
But what will say patient, I have started drinking 2-3 coffees in a day.
मेरा liver तो ठीक हो जाएगा. That's not fair too. Okay, painkillers can harm liver when misused or overused. Agree,
100% agree.
Okay.
Should not be used. Any painkiller should not be used, because not only liver, your gut is also going to get affected. So as a gastroenterologist, if I remember in last 10 years, I have prescribed painkillers, especially the non-steroidal anti-inflammatory drugs, like you say it is the Dynapar, means diclofenac, aceclofenac, such type of painkillers, hardly less than 100 times in my 10 years of career. Because we see, we always stop. I have stopped 10,000 times.
Right.
And I have started only 100 times.
So this thing I've observed in COVID. So this is my personal question now. Herbal supplementations से liver को कुछ नहीं होता है.
Totally disagree. Totally disagree. I will tell you the truth. During COVID, what was happening? The giloy you consider to be a healthy one. Healthy ones. So the people who are taking giloy for a long time, giloy has good property. It has an immunostimulant property. Yes. It immunity booster. But because of fear of COVID, everybody started drinking giloy too much. And if you search the Google right now, there is enough data that the Mumbai has witnessed liver failure and requiring liver transplant due to overuse of giloy.
So it's not like herbal है, आयुर्वेदिक है, तो हमेशा अच्छा ही है.
हमारा क्वेश्चन क्या होता है पेशेंट आते हैं तब? फर्स्ट क्वेश्चन क्या होता है? SGPT एबनॉर्मल लेके आया, फर्स्ट हम पूछते हैं कि लिवर में फैट है, यस और नो? नो फैट. हेपेटाइटिस बी या सी है? नहीं है. तो यार लिवर अफेक्ट क्यों हुआ? फीमेल है तो इम्यून कंडीशन की वजह से हुआ है. हाँ, पॉसिबल इन फीमेल्स. नहीं तो द फर्स्ट क्वेश्चन इट इज ड्रग इंड्यूस, वेदर ड्रग इज एलोपैथिक और हर्बल. फिर बोलेंगे पेशेंट कि 3 महीने पहले मैंने हर्बल पाउडर चालू किया था फॉर डायबिटीज कॉमन, फॉर वेट लॉस, दिस आर द कॉमन. तो मैम आपका जो लिवर टेस्ट एबनॉर्मलिटी है वो उसकी वजह से लिवर इंजर हो रहा है, प्लीज डोंट टेक. और ये एज ग्रुप इन 40+ एज ग्रुप में कॉमन भी है दैट दे थिंक कि आयुर्वेदिक या हर्बल है तो कोई जरूरत नहीं है ना, हम तो ले रहे हैं. डॉक्टर strongly discourage. Yes, the Ayurvedic science is there, but they have not reported these are the side effects. In allopathic medicine, the side effects are reported and started. So as soon as the Ayurveda science started reporting these side effects more and more, I think we can use the good part of Ayurvedic side effects.
100%। और एक वो डर है लोगों के दिमाग में कि एलोपैथिक की तरफ जाएंगे मतलब हमको तो डैमेज होना ही है, पर एज यू वर एक्सप्लेनिंग द होल पॉडकास्ट देयर कैन बी अ होल अप्रोच जहां हम पहले मेडिसिन ना लेके आए टेबल पे।
पहले मेडिसिन नहीं लिखना है, अगर लिखना है तो आप पहले से अपफ्रंट उसको साइड इफेक्ट समझाओ कि दीज आर द साइड
साइड
इफेक्ट्स,
इफेक्ट्स।
सो इफ यू वांट टू टेक देन यू टेक, अदरवाइज नॉट.
So let's come back to the rapid fire. Probiotics improve gut health always.
There are certain specific indications of the probiotics where
Which
it
can be?
always should not be used as a routine. Our home based curd or the one which is fermented foods are the good for gut health, that acts as a probiotics. Otherwise rest of the probiotics should be indicated जब हमारा IBD होता है, gut flora disturb होता है, तभी हम उसको probiotics देते हैं. So there are certain group but not always.
So हमेशा कोई भी प्रोबायोटिक उठा लिया,
नहीं.
मेरे को पेट में ठीक नहीं लग रहा है तो मैं ले लेती हूँ.
नहीं, that is not,
That
should
is not
not
the
be,
way.
should not be that way.
Okay. So if somebody wants to start 3 actions for their gut or health, or 3 habits जो उनको कल से अगले वीक से वो शुरू करनी चाहिए, what do you suggest the basic normal 3 habits?
Minimize your sugar intake, that is first.
Okay.
Second, restrict your salt intake, not should not be. And third, exercise. So if you ask me, sugar, salt and exercise, this is the 3 way you should, because many of your packet foods will contain high amount of sugar and salt.
Salt 100%.
At your home, if you're eating too much of carbohydrate, that thing related to sugar and salt. And exercise is mandatory. Daily 1 hour of exercise is mandatory. I started recognizing at the age of 40 and I'm doing for last 3-4 years now down the line. So I think exercise should be the integral part.
Doesn't matter the
Yeah,
age.
when you eat daily, you should exercise daily.
Doesn't matter the age. ऐसा भी नहीं होना चाहिए ना कि you are 50 अभी हम तो बूढ़े हो गए, हमको क्या जरूरत है
It is more will be needed because of the standing
right
in the later life.
So as we were discussing earlier, there's going to be World Hepatitis Day. If you had to give one sentence to remember for people on that day, what would that sentence be?
Stay fit and keep your liver healthy as much as possible.
Don't take it as a silent,
not as a silent. And you understand the liver, the largest organ, the metabolic organ, and you have to take care of your liver as well.
So as you're talking about that, now let's see, if you had to give one reality check, a pulse check to the viewers today for gut and liver, what would that be? Which people usually take it ke nahi aisa to nahi hai, it's a myth or it's a fact, if you can say. So one reality check that people should understand about your gut and liver.
So listen to your symptoms. Listen to your symptoms, and before symptoms you just examine and screen your body with, as we said, it is already early, means at the age of 20s 30s you should screen at least once for the issues if you have.
So to close it and put it all together, why do you think that people just in India or all over the world, however you feel to answer this, people and the system is still not giving enough focus to liver? Because as we were talked so much about it, it's a silent organ, silent growing. Why do you think, what is the actual gap which gut or liver health is still not getting focused on?
It is because they are all silent. That is what we are discussing, because that is the gap. Main gap is because of the silent disease. And the food pattern is going to change in India, the pattern, and the exercise awareness if it is. So you ask me the pulse, my pulse will be diet and exercise. You focus when you are eating something, where is my protein in the diet, where is my vegetables in the diet, I'm not eating too much of carb, I'm not eating too much of fat. That is my pulse.
So जो लोगों के दिमाग में ये बैठ गया कि अरे सिस्टम का इशू है, वो नहीं है, वो एक डिजीज ही ऐसा है जो धीरे धीरे ग्रो रहा है, तो हमें खुद समझना पड़ेगा कि हमारी बॉडी में क्या चल रहा है. नाइदर what the system is doing or what the doctors are saying कि हमको इतना दे दिया वो दे दिया, तो इसमें सिर्फ सिस्टम की गलती नहीं, it is a collaborative work if we put it all together.
Yes.
These diseases can only be reversed or cured when we work together as a system.
So initial, when we detect it early, it is always be able to cure and we can reverse it with diet and exercise. So my pulse is diet and exercise.
Great. Okay, so doctor, now I want to see how a day in life of a gastroenterologist looks like. So I'll ask you a few couple of questions how it does. So what is the first thing that you do when you reach your hospital or your clinic?
So first thing, in hospital we have already appointments OPD.
Hmm.
So we see the patients, and then usually we go, means that will take, in each and every patient will take around 15, 20, 30 minutes to examine the patient.
Hmm.
Provided gastroenterologist, the main job is to do endoscopies and colonoscopy and advanced endoscopy procedures. So usually parallel to the OPD, majority of the gastroenterologists parallel to do endoscopy and colonoscopy.
Yeah.
And at the end of the procedure we explain them what is wrong with, or what is to be done
Hmm.
with the patient. And till, I think parallel session will go till from morning 10 to 1.
Mm-hmm.
And then after, in the noon, we will take lunch.
Okay.
And 1 to 2,
Which
I
does
am
not
not
have a fixed time, I'm
yes,
sure.
yes, it does not have a fixed time. 1, 2, 3, 4.
Mm-hmm.
Yesterday I have much more patients, I took at around 3.
Mm-hmm.
Because thereafter, from T2 to 5, 2 to 6, again I see the OPD. So I restricted myself from 10 to 7 as much as possible.
Okay. So in that 10 to 7, usually how many, on average, how many number of patients do you see? And out of that, how many are emergency cases, like numbers?
So in a gastroenterology clinical practice, emergencies will be a less. It is more
Hmm.
of a consultation.
Hmm.
Hardly 10% of the patient will present with emergency, like something stucking of the food, or something GI bleed, or
Okay.
having a stone in the bile duct. So these are the
Hmm.
emergencies what we see.
Hmm.
Majority of the patients are routine elective kind of this. And on an average, I at current point of time I see 20-25 patients in a day.
Okay, that's a big number.
So
So I also wanted to see ki something that you do in a day which patients usually don't see. Rarely, they rarely understand that this is also part of being a doctor.
so anything I try to do in the morning from 7 to 8, gym and exercise,
Yeah.
that with the music I love
Okay.
and thereafter, when evening, I try to teach my kids, if that is the way, I
So the
think.
behind the white coat scenes,
Yes,
obviously they don't see
yes,
that.
yes, yes.
So how do you handle the emotional or mental weight of all the emotional things that happen around you in the day?
The whole day it runs around emotions. And
Hmm.
if you are an emotional person, it will be very difficult to handle the whole day. There is a
Hmm.
narrating something, because as a gastroenterologist and endoscopy,
Hmm.
we D in and out,
Hmm.
we diagnose cancer in every
Hmm.
1-2 patients every day, new patient.
Oh my god, every day.
Because we do endoscopy and colonoscopy,
Yeah.
they're referred because of some problem.
Hmm.
So every day you have to communicate the bad news to them.
Emotionally takes a toll on you also.
Yes, the majority of the times it is or patient will come, पेट में दर्द हो रहा है.
Hmm.
And many of the times they come with all reports, blood, investigation, endoscopy, colonoscopy,
Hmm.
CT. We end up, what I'm going to write, what I'm
Hmm.
going to explain to the patient. I have no ideas, because medicine is still, it is not like one to one.
Hmm.
So we have to sit for 10, 15, 20 minutes, understanding the lifestyle of patient, understanding something, what is going wrong,
It has to be personalized.
very personalized. Because
Hmm.
majority of the times now the patient comes with all report, and still I am getting pain, or still I am having something problem. So every time your mind throughout the day continuously becoming like a detective. For a gastrophysician,
Yeah.
it is just like searching this and this. So yesterday it was, I think I see 30 patient, but at the 7 o'clock I said, no, please, no more new patients, no more patients.
And you, that also takes a toll on you, that you said no to a patient. If there's a patient, then sometimes if you are
Yes,
not emotionally
yes,
there, you sometimes would have to take your take also.
yes, because we have to say no. So कोई कॉल करेगा, डॉक्टर फ़ोन नहीं उठा रहे, आंसर नहीं
रात
दे
को
रहा है.
12 बजे.
12 बजे अभी तो पेशेंट समझते हैं, बहुत कम पेशेंट कॉल करते हैं,
Hmm.
और जब भी दिक्कत में होते हैं
Emergencies is a different
तभी
story.
करते हैं. पर मेजॉरिटी ऑफ द टाइम्स प्रॉब्लम इज विद द सोशल मीडिया एज वेल. दे
Yeah.
इमीडिएटली रिपोर्ट व्हाट्सएप. सो डॉक्टर मैंने भेजा है, आप रिपोर्ट देख लो. बट
अभी
आई एम,
अभी देख लो.
अभी अभी देख लो. अरे मैंने व्हाट्सएप का नंबर आपको दिया था, वो आपकी
इमरजेंसी के
कन्वीनियंस
लिए.
के लिए, कि जब मेरे को टाइम मिलेगा तब मैं
Hmm.
आपको उसका आंसर करूंगा. इट इज
Yeah.
नॉट दैट योर रिपोर्ट इज जस्ट अराइव्ड एट 1 o'clock and I am going to see at 1:05.
Yeah, 100%.
So that
How
helps.
does your family respond to all this sometimes?
my my wife is saying, That means because we don't get time for the
Yeah.
kids, so that is very means very difficult question to answer on the public mode. But many of the times they are not always satisfied, because we try to satisfy the patient. My wife says, you try to satisfy them, you're not satisfying the family.
Yeah.
So majority of the time there is a imbalance, and that is happens with every doctor's family, I think.
So being a doctor, obviously you have your own health journey. So what is one thing that you definitely, whatever happens in that day, you don't compromise that with that one healthy habit, even if it's 12 o'clock at night or it's 4 o'clock in the morning?
So you ask a good question. That is my one of the favorite question, because I'm talking about myself.
Hmm.
When I told you, when I had weight around 79 when I completed my DM.
Yeah.
I came to Ahmedabad. I was suffering from fatty liver.
Right.
I realized something wrong in the body. I
Yeah.
did my weight loss by walking 10 kilometers to 14 kilometers in a day.
Mhm.
At that time, I didn't realize strengthening is also an important part.
Important part.
Surprisingly, I have a small trauma and fracture. So I
Okay.
realized I something something wrong with my bones,
Mhm.
and I realized I'm suffering from osteoporosis.
Okay.
So myself, I realized something wrong with my body.
Listening to your body
Yes.
again.
Now whenever I have some pain in the morning, I say, मेरे को gym जाना ही है.
Whatever time it is.
Yes. So 1 hour
Right.
of day, and my core diet is now focused. I'm not take too much of sugar and salt. That is my rule, and I'm
Okay.
not going to take. I have watch always on my diet.
Mhm.
Friends surrounding me and family surrounding me has
Hmm.
already recognized, and they are trying to follow my habits,
Right.
because they see change in
Change in
my
you.
body. Even my patients, they ask 5 years back, they say, oh
Mhm.
sir, why you are looking so fit and young? Because I have modified my diet and I'm going to gym and exercise
Hmm.
daily. That is the reason, and I'm not going to give this up for my life.
Great. So last question for today. What do you would say to, in general, any general public, not just patients, that being a doctor, one sentence in what you would put a doctor's life into, and they would understand what a doctor's life feels like from your perspective, not the patient's point of view?
I will say I want to see the still respect for the doctors.
Hmm.
I think, and listen to your doctor carefully. That is the only thing. What I
Yeah,
would
they
what
know it.
Yeah. So listen to the doctor.
Hmm.
Don't try to see. Many of the times they understand and go on opposite way, but I think all they are doing, they are trying to get rid out of this.
Yeah,
Means कि whatever the problem you are suffering, they are trying to get it. So listen to the doctor and follow the doctor whatever they say.
they have the knowledge and expertise for it. They
Yes,
are
they are.
not kidding, guys.
Yes.
So that's the last
Follow,
statement to leave.
yeah. So follow your whatever the doctor is you are
Hmm.
visiting. Just follow their advice.
Great. Thank you so much.
Thank you.
If you think that this was relatable to you and you like to see this side of the healthcare, then you should subscribe this channel for sure. Again, welcome to Pulse Check.